Radiation exposure can have biological effects, regardless of whether it originates from natural sources or from ionizing radiation devices. What are the main mechanisms by which radiation harms tissue? Ionizing radiation refers to any type of radiation that has the potential to ionize an atom. When an atom becomes ionized, it experiences considerable chemical alterations. The bonds between atoms are broken, which disturbs the molecular structure. An ionized atom can regain neutrality through electron capture, which allows it to create new bonds with nearby atoms and molecules. Ionizing radiation has the potential to directly change a cell's destiny if it causes ionization at a crucial site like a DNA strand. A cell that experiences this change may continue to live without significant harm. However, if essential physiological processes are interrupted, the cell could perish. Additionally, it might undergo a mutation which could have repercussions for the cells produced during its division, potentially leading to their death. A significant consequence of a cell mutation is an alteration in the cell's life cycle. It starts to reproduce rapidly, becoming mutated and altered. This marks the onset of a harmful condition known as cancer. Ionizing radiation can have a direct impact on individual cells, with consequences that might not become evident for several years. However, the likelihood of radiation hitting a vital part of the cell is quite low. Conversely, ionizing radiation can have an indirect impact on health. When ionization occurs in a non-essential molecule for cellular function, like a water molecule, it breaks down into hydrogen atom and hydroxyl group. This can lead to the formation of a new water molecule, but the two hydroxyl groups may also combine to create hydrogen peroxide. This represents a different kind of radiation-induced harm to the body. Hydrogen peroxide is recognized as the most potent natural oxidant, capable of damaging cell membranes and ultimately destroying the cell itself. It's as if radiation has infused a highly toxic substance into the body, resulting in the destruction of cells, tissues, and even entire organs. This occurrence is referred to as the indirect impact of ionizing radiation on the body. When the body is subjected to a high level of radiation in a brief time frame, usually just a few minutes, a large number of cells can die quickly. In these situations, the main consequences of radiation are indirect. The body does not have enough time to fix the damage, which increases the risk to tissues and organs. Some of the acute radiation syndromes will emerge, depending on the amount of radiation absorbed. The initial symptoms include nausea, vomiting, loss of appetite, and so on. The very first victim of a large dosage is the bone marrow, which creates blood cells. This is due to the bone marrow's high reproduction potential. Acute bone marrow radiation syndrome occurs at doses greater than 0.7 grays, and the fatal dosage for 50% of those irradiated within the next 60 days ranges from 2.5 to 5 grays. After bone marrow, the gastrointestinal system is the next victim, with symptoms emerging at 6-grade doses. Mortality is 100% at dosages greater than 10 grays. The cardiovascular system is the last to be harmed by radiation. Cardiovascular acute radiation syndrome develops at doses of more than 50 gray, although it can also occur at considerably lower levels. With this condition, there is no recovery. The effects and symptoms of acute radiation syndrome, regardless of its main type, can be directly linked to the amount of radiation dose received. It is evident that the lethal dosage is more than 10 grays, while the mortality threshold is 1.5 grays. Low doses of radiation received by an individual over extended periods, such as months or years, can lead to two types of consequences. In this case, cells are directly impacted by the radiation. If the alterations occur on a DNA strand of reproductive cells, they can be inherited by future generations as mutations, known as genetic effects. However, direct harm to other cells can trigger changes in an individual exposed to radiation, resulting in somatic effects, including mutations that often lead to the formation of cancer, also referred to as carcinogenic effects. Every dose of ionizing radiation, regardless of its amount, increases the likelihood of genetic and somatic effects.